How is subglandular implant placement done? Have you ever wondered how subglandular implant placement works in breast augmentation? This technique involves positioning the breast implant, whether silicone or saline, directly behind the breast tissue but above the chest wall muscle. The implant rests just beneath the natural breast tissue, providing a unique aesthetic. The process begins with an incision. Surgeons often choose the inframammary fold, which is the crease under the breast. However, they may also use other incision sites like around the areola or even through the armpit, depending on the patient's anatomy and the surgeon's preference. Next, the surgeon creates a pocket between the breast tissue and the chest muscle. This pocket must be just the right size. If it is too tight, it can cause complications, and if it is too loose, the implant may not sit correctly. Once the pocket is ready, the surgeon inserts the breast implant into this subglandular space. Since the implant lies directly behind the breast tissue, the natural tissue helps cover it, which can lead to a more natural look. After inserting the implant, the surgeon adjusts it to achieve the desired shape and symmetry. Because the implant is not placed under the muscle, it is less likely to be distorted by muscle movement, which can be a concern with other placement techniques. Finally, the incision is closed with sutures, and dressings are applied to support healing. Subglandular placement is often seen as less invasive than submuscular placement. This is because it does not require manipulating the chest muscle, which can lead to a shorter surgery time and quicker recovery. Patients may also experience less discomfort after surgery since there is no muscle involved. However, the choice of subglandular placement depends on individual factors. For instance, having enough natural breast tissue is important as it helps hide the implant edges and reduces the chance of visibility or rippling. Skin thickness and elasticity also play a role. Thinner skin may increase the risk of seeing the implant. Lifestyle matters too. Women with strong or large chest muscles may benefit from subglandular placement, as it reduces the risk of distortion during muscle contractions. From a plastic surgery perspective, subglandular placement can yield natural-looking results, especially for those with sufficient breast tissue. It is often chosen for its quicker recovery and less post-operative discomfort. However, it may carry a slightly higher risk of capsular contracture, which is when scar tissue tightens around the implant, compared to submuscular placement. In summary, subglandular implant placement involves placing the implant behind the breast tissue but on top of the chest muscle through a carefully created surgical pocket. This technique balances less invasiveness and quicker recovery with considerations of tissue coverage and aesthetic results. Consulting with a board-certified plastic surgeon is essential to determine the best approach for each individual.